like to go back to this question of pain control and effective pain control. So, recently I was involved in a study with Rimadyl. It's actually using Rimadyl to help determine how many dogs suffer the clinical signs associated with OA, and those data support the figures we were talking about, roughly half the dog population. But if we think about effective pain control and the tools that we have, and we think about diagnosing OA early in dogs, how comfortable do people feel using, for example, the nonsteroidals like Rimadyl, like Previcox in young dogs, and for how long?
I'll take that one. I feel quite comfortable. Now the problem, I've got to compartmentalize a little bit because we're talking about the early dogs with some early signs. So nobody would want to condemn a dog to have to take those medications every day for the rest of its life. However, until or unless that patient gets relieved of some of that discomfort, all these things that we're talking about are going to be not maximized,
right,
including therapeutic exercise and so on. Furthermore, there's a whole process. We've mentioned it, I think, at the very, very beginning, and maybe it's time to bring it back right now, and that is the issue of sensitization. With chronic inflammation, sensitization can occur for a lot of reasons, including when Bryan cuts a nerve in surgery, right? So it can happen instantly, but certainly with chronic inflammation, it begins to happen both in the spinal cord and in the peripheral tissue, in the joint itself, in the synovium. And that begins to become amplified. So it's like a big rheostat. The vernacular term is wind-up. We know that term, but it's a real molecular cellular process that begins to happen, and chronic inflammation leads to it. And so by reducing inflammation with drugs, the NSAIDs and possibly the Piperin classes as well, now that you are rendering a clinical benefit, not just in that immediate time frame, but perhaps for quite a long period of time after that. Now, how long does a patient go on when it's early? Only so long as everybody is comfortable that we've kind of reached its maximum effect. But I want to point out that there are some studies with two that I'm aware of using NSAIDs for 6 months and then a year. These are more advanced cases. Those dogs never stopped getting better as a group. Right. They were getting better up until the day that study ended. So something is happening besides just reducing inflammation. There's other pharmacologic benefits that are occurring, and it's probably in the realm of diminishing that central and peripheral sensitization.
So you see the anti-inflammatory, the analgesic component of treating young dogs with OA as very important to prevent these deleterious changes in the future.
You get the immediate benefit from its immediate analgesic effect and by interrupting that prostaglandin and prostanoid production, but also over time decrease sensitization as well.
Bryan, how comfortable do you feel using NSAIDs in these young dogs?
I agree totally. I don't have a problem with it, and I think one of the keys, as you just said, is getting them out of that cycle of inflammation, that cycle of pain, and it really is important that we do it, to prevent those chronic changes. And I kind of have always lived by the adage of use as little as needed, but as much to be effective. So the nice thing is with this multimodal approach, using various things, weight down, dietary changes, the high omega-3 fatty acid diets, those things, in these young animals, you may be able to effectively titrate that dose down of a nonsteroidal to what is effective, and that's the key. What's an effective dose? For each patient is going to differ and is going to change. Each patient is an individual, and so that's where evaluating them on a regular basis with some of these metrics that we've talked about is key, is being able to tailor that treatment so that we are using what's effective, but if we can reduce the dose in some of these things that we're using and use them long term and reduce the potential for any issues, that could be very beneficial in these days.
I was just going to ask about dose reduction or frequency, or reducing the frequency, or
I would do dose reduction. Dose reduction.
So daily reduction on the dose.
I think if you can, I think that's certainly possible, and I think that's certainly something to kind of aim for, because with this multimodal approach, if you're using, say in the geriatric patient, if you have, several vials of things, several bottles of drugs you're using, you can effectively lower the dosages of some of those to potentially have the same efficacy. But I think the key is making sure that that patient is effectively, the pain is treated effectively in that patient. And each patient is an individual.
I absolutely agree with that, because certainly from a clinical research perspective, we looked at continued dose versus dose reduction, and you can successfully reduce the dose and maintain efficacy, but it's on an individual basis.
Yes.
Which
Sure,
comes back
sure.
to the whole idea of assessment and monitoring.
Absolutely.
And actually, then in order to assess these patients, you need to get them back into the practice. So we need to be getting them back in on a regular basis.
That's good for the practice too.
Do you think for the early OA patients, getting them back in on a more frequent basis as you might in a geriatric patient is the way to go? As the patients get older, the recommendations were to see them more frequently. Is that something that for these OA patients, we should see them on a more frequent basis as well, or is this something you do over the phone?
Yeah, because I mean, going back to the younger patients and the talk about putting them on nonsteroidals, which could be very, very long term, I think the key thing that I think a lot of people don't understand, we have to damp down the inflammation in the pain signaling that's coming from the joint, because once we have, and truly what we're going to end up with is damage to the spinal cord. And I think a lot of people forget that, the chronic pain in the periphery actually damages the spinal cord. And once we get the sensitization in the spinal cord and all that going on, that's much harder to treat. So I think once we understand that there's, good reasons to give these young animals the nonsteroidals, because we're going to then protect what is something very difficult to deal with. And that's probably something we can discuss a little bit more, is like protecting the spinal cord.